Great. The Ethics of Organ Transplant Allocation by Kimberly Coston. Today I'm exploring the ethics of organ allocation and how we decide, or how medical professionals decide, who will get an organ, who will receive transplants, and who will not. It's based on specific criterion, used together, I think, are very ethical. If they are used singularly, then there are a lot of questions left up for discussion. One of the criterion would be merit, which I don't discuss much in this paper because I don't believe that it matters whether you're a student or a gangbanger, whether you should get allocated an organ or not. So that specifically I will not talk about. What I am interested in is using age, medical benefit, and the ability to pay together as criterion for allocation. And we are going to decode what the maximum benefit means according to my research. First, let's talk about how the system works, which is you have to be referred by your internist or your specialist or your general doctor to a transplant center. And before you're even referred to the transplant center, you have to meet specific criterion. So the first thing would be age. You can't really decide, if a person is older, that they shouldn't have an organ just because they're older and they've lived their life. Now, if you're going to use age to, in a coupled with the ability to pay or the best medical outcome, maybe a younger person would be more healthy than the older person, and so then they would receive the organ based off of their medical history at that time, not because they're just younger, because a 74-year-old could be much healthier than a 34-year-old, and then in that situation they would be allocated the organ. Then there is the criterion medical benefit. What does the patient see the medical benefit being for themselves? Do they see them being able to live out their life and do the things that they want to do? Those are things that you would discuss with your physician before you were referred to an organ transplant center. If you don't feel that you would have a good outcome, you don't see a medical benefit, then it would probably not be the best thing for you to have a transplant. I mean, you may decide to be non-compliant or, just overall not do well with the transplant based on how you feel about how you project your prognosis to be. Finally, I wanted to talk about the ability to pay. When you first hear that, I immediately thought that no, you shouldn't, use that criterion. But, based on my research and what I found out to be was that I know the surgery is expensive, but so is the aftercare. You have to take so much medication, anti-rejection medication, and so forth. And it all comes up to about $2,500 a month to be able to, if this is for years and maybe forever or the lifetime of the organ that you receive. And you have to be able to afford this or the organ's going to fail. Quite frankly, why would you allocate an organ to a person who is not going to be able to pay? They don't have the insurance. They don't have the finances to be able to keep this organ up and to give it its long, potential lifespan, which could be 15, 20 years. If that person may receive that organ and only have it for, let's say, 3 or 4 years because they can't afford to keep up with the medication. And I think in this instance that it is ethical to allocate that organ to somebody who is waiting, who can afford to take care of it. So with that being said, using the ability to pay coupled with other things like age and medical benefit, I don't think is unethical at all. And finally, I'd just like to say that there should be more exploration done on, how to provide cheaper medical maintenance for transplant patients. But until that is explored more and we come up with a way to do that, I think that the maximum benefit is what we should focus on, and getting the patient the maximum benefit, and the organ. We have to consider the donor's organ. We want to do the best thing for that organ out of respect for the patient that donated it. Ultimately, I think maximum benefit is the best criterion for deciding which patient would, be able to be allocated the organ, and which patient to choose to give the gift of life. Thank you.